Hi, this is Mark Struthers. Today we'd like to take a look at individual medical images, repeating the images, and their impact upon interpretation and diagnosis. Let's take a moment and reflect. How common is a misdiagnosis of the image exam or a misdiagnosis of a medical image because of poor image quality? Diagnostic errors are under-recognized and underappreciated in the practice of medical imaging. Today we want to talk about image analysis and repeats and or misdiagnosis that are the result of poor quality imaging being interpreted by a radiologist. Nearly 75% of all medical malpractice claims against radiologists are related to diagnostic errors. These errors may be due to a misinterpretation by the radiologist or a poor quality image acquired by the radiologic technologist or medical imaging technologist that is eventually interpreted by the radiologist. Image quality assessment is reported to be subjective and significantly differs between and among radiographers, medical imaging technologists, and radiologists. The radiographer or medical imaging technologist is looking for technical quality of the image as opposed to diagnostic quality of the image. The radiologist, on the other hand, is looking for both technical quality of the image and diagnostic quality of the image. Even though diagnostic value would mainly be the radiologist domain, the medical imaging technologist needs to consider the image's diagnostic value. Let's take a moment and look for 10 things that should be considered when analyzing an image for repeat prior to sending it for interpretation. You notice the first things on the list are check the area of interest carefully before doing the repeat image. Next, to repeat or not to repeat an image is a question you should ask the radiologist if it's not obvious. Thirdly, the choice of exposure factors in X-ray and positioning are the big reasons for repeat images. It's a challenge to take a look at repeat rates because there is a difference between experienced radiographers and radiographers that are new to the field or medical imaging people that are new to the field. Those that have been in the field longer hopefully have more experience and knowledge than people coming into the field. And when they analyze images, the criteria they're using is not only the quality of the image, but is it diagnostic? Most radiologists would like to see the exam that was repeated as well as the original, so that they might have some information on the repeat that they did not have in the original or is of great interest. Medical imaging technologists generally tend to favor technical characteristics of the image. The medical imaging technologists are inclined to assess the quality of the image for positioning, exposure, etc., and they are not looking specifically if there was anything on the image that may be of importance in a diagnostic situation. There are times when you're doing trauma cases in the emergency room that some of the images that you think are poor actually have vital information on them. Quality does matter, and when analyzing an image, you should decide whether the image is diagnostically acceptable or unacceptable. If it was excellent, there were no errors of patient preparation, exposure, positioning, processing, or electronic image transfer. If it's diagnostically acceptable, some errors of patient preparation, exposure, positioning may be apparent. A recent study found that radiographers or medical imaging technologists kept on average 63% of the cases or images. What happened to the other 37%? Images pre-assessed as of low quality were rejected the most often. These rejections were based upon lack of image criteria fulfillment, or low diagnostic image quality. So let's look at the 4% or so of misinterpretation errors and the 37% of acquisition errors. Where do you think we need some more emphasis? 47% of the rejects were due to positioning. Positioning, or tube, part, receptor alignment, is one of the basic tenets of radiology education. Not all medical imaging exams require a standardized set of positioning. A skilled radiographer or medical imaging technologist is able to position the patient to demonstrate the area of interest to the radiologist and the referring physician. A misdiagnosis describes a situation when your healthcare provider tells you, the patient, that you have some illness or condition, but it's incorrect. Unfortunately, missed and misdiagnoses are rarely reported because there's really no mechanism for reporting them. Beyond the misdiagnosis, there are other interpretation failures. So failure to note down some minute findings in CT or MRI scans is known as underdiagnosis and not misdiagnosis. Both misdiagnosis and underdiagnosis can delay appropriate care for the patient. It is very difficult to have a good quality assurance program if we have underreporting of the radiologist's misdiagnosis. According to a recent study by the American College of Radiology, only 15% of radiologists report their errors to patients or referring physicians, and only 9% reported them to risk management or quality assurance committees. So let's take a look at this scenario. The medical imaging test is not properly performed. Therefore, the radiologist does not visualize the information that would be obvious on a properly performed exam. Is this a misinterpretation problem or an acquired imaging problem? Either way, what happens if a radiologist makes a mistake? If a radiologist, for instance, is reading an MRI and interprets it wrong, it could be a setback for the patient to get proper treatment and have serious repercussions to the patient's health. The number one error is the communication error. It doesn't matter if you had a perfectly acquired exam and a perfectly interpreted exam if that exam does not get communicated to the people that need it for treatment and diagnosis. While radiologists rarely communicate directly with patients, they must effectively communicate their findings to the physician who relies on the results to make the treatment decision. So let's say the results were sent to the physician. They also must be read by the physician. Many times the recipient of the report finds it very boring, etc., and so they skip right to the impression on the report, the conclusion, and that is all they read. This can result in a misdiagnosis by the physician in doing their treatment or ordering further exams, whether they're imaging or laboratory. According to a recent study, a radiologist gets only 3 to 4 seconds to review an imaging study. With this workload, perception can be a major problem. Probably the most common type of mistake is an error in perception. The abnormality is present on the image or scan, but the radiologist for some reason does not see it. Because perception is based on an individual, what we're looking for as a helper is the use of artificial intelligence. The artificial intelligence algorithms can read even voluminous imaging studies with complexities and recognize the abnormalities in a short span of time, giving more or less qualitative reports. The AI reports can be used by the radiologists as a tool to help them in their interpretation. Diagnostic error has been defined as a diagnosis that is missed, wrong, or delayed as detected by some subsequent definitive test or finding. So we're looking after the acquisition and the interpretation, and when another test comes up, it points out that there is some sort of error. Approximately 4% of radiologic interpretations rendered by radiologists in daily practice contain errors. Other physicians who are interpreting X-ray or images may have a higher error rate. Overall, approximately 30% of abnormal radiographic image studies are missed. A 2013 retrospective study found that the error rate among radiologic examinations is about 30%, with real-time errors in daily radiology practice between 3 to 5%, and this is how we came up with the 4% average. To reduce the amount of misinterpretation and poor acquisition of medical imaging, it is important to have standardized guidelines and quality assurance measures to ensure optimal image quality and patient care, and to see that they are utilized. Please review this hierarchy of principles, policies, standards, procedures, and guidelines, which is recommended for medical imaging. Standardization will help eliminate variances in the medical imaging process.